Hello, everyone. We'd like to welcome you to the COVID-19 Minimizing the Financial Impact on Your Dental Practice weekly update. I do have a few housekeeping announcements before we get started. Today's session will not count for CPE credit. Your phone lines have been muted. If you have any questions, please feel free to use the Q&A box, which is located on your Zoom webinar control panel. Today's session will be recorded for future viewing. With that, I'd like to hand the time over to Art.
Good morning, everyone. Welcome to our weekly Eide Bailly HMWC COVID-19 relief options for you and your dental practice weekly update. So we have a special hour and a half for you today. A lot of really good information. When I put this PowerPoint together yesterday, I kind of emailed the panel. I said, "Oh boy, we don't have a lot of updates." Well, Megan, that changed, what, about a half hour ago?
45 minutes.
Oh, okay. Well, they gave us 45 minutes. The last guidance, they gave us like 30 minutes. I think someone has a Tuesday surprise ready for us each time. So just so you know, folks, and we're going to talk a little bit about this, about 45 minutes ago, the Democrats put out an 1,801-page bill with proposals for basically CARES 2.0. Is that what it is, Megan?
Yeah, I think that's what they're calling it, the HEROES Act, but it's CARES 2.0.
Okay, and there are proposed changes to the payroll protection program, which we, again, you know, we believe we're all superhuman, but not that superhuman. We've read, Megan and I and Scott have read a little bit of it, what we've come up with, and we'll tell you what we think is in it. But obviously, there's a lot of negotiation going on. So let's go ahead and introduce, if you would, please. Okay, thank you. As you know, we're merging with Eide Bailly on July 20th. If we all live till July 20th with all these changes. My name is Art Wiederman. I'm a CPA and a partner at HMWC CPAs and Business Advisors in Tustin, California. I'm with Scott Haberman, who is a CPA. He is a dental-specific CPA out of Fort Collins, Colorado office of Eide Bailly, which is, again, the firm that HMWC is very proudly and happily merging with at the in the middle of July. And he is a new tax partner, so we congratulate him on that at Eide Bailly. We have my dear friend, Ali Aramshian. Ali, for those of you who don't know Ali, out of this, if you're in the state of California, you've probably seen Ali on multiple webinars. He's been the voice of the California Dental Association since this started 7-8 weeks ago. Ali is the president of Dental and Medical Council PC. So his company, he is a dental specific attorney. He is also a dental specific labor law attorney. He has a wonderful company called HR for Health. And so Ali is going to spend probably the last hour of this talking to you about how to open your dental office, how to communicate with your employees. There are lots and lots of legal issues involved, not only in the opening of your office, but also in the, you know, what happens if Susie at the front desk calls up and says, my school is closed, I can't come back to work, or I'm making more money on unemployment than working for you, and now you need to start spending your PPP money, so I don't want to come back on payroll. Ali's going to cover a lot of that. And then we have Megan Mortimer. Megan has been with us on every one of these. The congressional, she is the congressional lobbyist, one of 4 of them for the American Dental Association. And Megan is the one that just sent us the 1,801-page bill. And she said, Art, read it. We have 45 minutes. No problem. She has been amazing. And I didn't realize we were going to have Dan, but Dan Bywater, who has been, who's with Ready Capital. He is the person who's been our lifeline to what the banks are doing. I will tell you that I have received numerous compliments on what, let me put it this way. Dan has probably saved 10, if not more, of my clients who were applying for the PPP loans, who could not get answers, who could not get through. I sent them over to Dan. Dan got it done. So he's been great. All right, let's go to the next slide. What we're going to talk about is some of the changes here, but we're going to kind of modify this thing on the fly because of what we got 45. This literally, this is our lives, folks. We get these changes. We're watching constantly. There are potential changes to the employee retention credit, idle loan limits. We'll talk about the PPP here, the loss of the tax deduction. Yesterday, Senator Marco Rubio gave a talk to the Florida Institute of Certified Public Accountants and made some very interesting comments. And then we're going to probably take about a half hour to get through all of this, I would think. And then we're going to turn this over to Ali, who's going to give you some amazing information. All right, so let's go to let's start. Megan, I'm almost thinking maybe we just start with what they gave us. Let's just put that right at the top and say, so 45 minutes ago, this is the Democrats' proposal?
The House Democrats proposal text, but they did it in conjunction with the Senate Democrats.
Okay, so this is the Democrat proposal. So this is an actual, they actually wrote it in the form of a law, right? This
Right,
is the
so
bill.
this is the bill text. We just don't have a bill number yet because it hasn't been gone through the process of being specifically filed. But the House Democrats put forward this is their want, this is their litany of desires in terms of what they would like to see in the next COVID relief package. And as you know, in the House, the Democrats are in the position of leadership. So they're going to be voting on this bill text on Friday, most likely.
So likely it will likely pass because we've got about a 40 to 50 person majority in the House.
Mm-hmm.
Then it will go to the Senate,
Mm-hmm.
which will, I mean,
that's where the negotiations will really start to heat up. We're not going to see a final version of a bill that's been negotiated probably for another couple of weeks. That would be my best guess. But this is the negotiation that they're putting forward as their first seat at the table, and then everybody will come and decide what they actually can agree on.
So Mr. Schumer and Mr. McConnell are going to be talking.
Most likely, Ms. Pelosi and Mr. McConnell will be talking, and Schumer will just be sitting there and listening. We'll see. We'll see how it works. But yes, we are expecting it to pass the House on Friday. Again, though, whatever we tell you today in the summary of this bill is not going to be the law of the land, probably in the form that it is in this bill. But we're hopeful because this was a lot more than we were even expecting in an initial proposal for the Democrats for a lot of what we've been asking, that we're hopeful that they can get to the middle of the road.
Now, again, this is about as breaking news. My joke has been, Megan's been our roving reporter. I mean, this is crazy. This is crazy. 45 minutes ago. So
I promise
Megan,
I don't plan it this way.
What's that?
I promise I don't plan it this way.
No, we know this is not your fault, but we are so appreciative that you bring us this information. So, Megan, the first proposal in there says that they are going to expand the 8-week covered period to 24 weeks.
Yes, that is what it says, or December 31st, whichever comes first for when you receive the funds.
Well, and the fact of the matter is that you're only allowed to apply for PPP at the moment through June 30th.
Right.
So it's probably, so therefore, you now have your money. We've told you that you need to spend it to get forgiveness in the 8-week period up until 45 minutes ago. Now, again, this is not law, folks. So do not take this as law. Right now, they still want you to spend this money, and we just don't know what's going to happen. So I don't know how this changes our decisions as to what to do here. What it probably does is for people who are thinking about holding on to this money until their dental office is open, it might push them closer to doing that because they might have more time, Megan, to spend this money, right? If this comes down.
I think who this is most positive for those people who are like, you know what, I don't want to have to worry about the loan forgiveness. I will just take this loan, take the agreeable terms and deal with it, use it how I need to use it and not have to worry about the loan forgiveness. I think what this may do is give some comfort that they might actually still be eligible for loan forgiveness if they decide to spend the money in various ways or over a period of time because that's the better decision for them. But yeah, I mean, it's a positive first step towards that flexibility, but people shouldn't be changing their decisions based on a Democratic proposal from the House.
No, not at all, because it could get shut down. And by the way, this is a big bill. This is, I don't know how much this is pumping more money into the economy, right? Yeah,
Yes.
I didn't see the amount. Is there an amount that they're talking about with all things considered?
There is, but I wasn't able to pull it out in time, but I know that there is an additional dollar amount. I also would like to say that they changed the loan terms, as we talked about, from a 1 year to a 5 year maturity as well.
I didn't see, okay, so yeah. So they, from a 2 year to a 5 year, right?
Sorry, yes, from
That's
a
okay.
2 year.
Yeah, which
2
we
years
had
to 5
talked
years.
about. So that means that, you know, not getting forgiveness and using this money potentially. And again, Megan, I'm still not convinced that something isn't going to come out that says that if you don't use all this money during the covered period, that you don't have to give it back to the bank. I haven't seen anything one way or another. I mean, we believe that we can use this money potentially as working capital. We don't know what we can use it for after the 8-week or 24-week period. We just don't know until they tell us the guidance, right?
Right.
Yeah. So I think that this is going to, and the other thing that's interesting is that the amount, I mean, we were all convinced that this second round of PPP money was going to absolutely run out in a day or two.
Mm-hmm.
Well, it's kind of really slowed down, and we have a slide on that coming up. So I think people are getting, I read an article in the Wall Street Journal yesterday that people they're souring about this. It's not what everybody thought it was going to be. So maybe this changes things. We'll see. So let's go into the other thing that it said, this bill that I read, it said that in calculating your full-time equivalent employees, that if you can't rehire someone or you can't find a qualified person to rehire that person to replace somebody. So Ali, somebody goes ahead and says, I'm afraid to work as a hygienist in your dental office because I'm going to get sick, and we can't find another hygienist to work in our dental office. That might qualify us, and they might not count that as against us in the FTE. Megan, is kind of what I was reading here.
Yeah.
Yeah,
That's great.
yeah, we'll see. If you would be so kind as to go to the next slide. Thank you. So before 45 minutes ago, so we have before 45 minutes ago and after 45 minutes ago. Before that, there was a bipartisan group of House members introduced a bill to expand the employee retention tax credit. Now, we have been talking for weeks and weeks and weeks, Scott, about the fact that the PPP loan with the forgiveness was a better deal for most of the dentists than it was than this employee retention tax credit. So yesterday, I was telling the group beforehand, I have a large dental group, and I think they're listening. I did a 2-hour meeting with them, and we went through for 2 hours the numbers. Their particular situation is that they're not going to open. Their state is not going to open for another 3 weeks minimum, and at a maximum, they're going to be able to have 25 to 50% capacity because of social distancing and what their state's telling them. And when we did all of the math, they were only going to bring back about a third of their employees. And with all the things going on with the PPP, we actually decided that it may very well be better for them to pay back the loan and use the retention credit, which was going to be as much as $70,000. And that was the first time I've ever dealt with that. Now they are proposing the employee retention credit. Number one is going to go from 50% of the first 10,000 to 80% of the first 15,000, which is 12,000. So Scott, under the new math, that's about 2.5 times the credit amount. That's what that looks like, doesn't it?
Yeah, that's a pretty good deal. Yeah, just under 2.5.
And they're also saying that, and Megan and I were kind of talking back and forth before we went on live here, is that we believe that once you exhaust your PPP money, if you still if you've done that and you're paying wages and you meet the requirements, even though you've taken your PPP, you can qualify for this credit. That's kind of how you and I read it, Megan? Yeah. So basically the rules on this credit are this. if you have a 50% or if your revenues in a calendar quarter are 50% or less than what they were in the prior year's calendar quarter, you qualify for the credit. So let's think about this, folks. Quarter one for everybody, probably nobody's going to qualify for this credit because we really didn't stop working in the dental office any earlier than the 15th or 16th of March. And we were collecting money after that. So my guess would be is that most dental offices, most businesses' revenues were more than 50% than what they were last year. Q2, everybody's going to qualify because we've pretty much been shut down for the last 2 months. Q3 probably will qualify too, depending on how fast dentistry comes back. And then Q4, who knows? But this could be a good decision for some people, you know. And again, if you follow the law, we've been talking from day one. The government wants you to spend this money over 8 weeks, and they want you to put people back on payroll the first day you get the money. That was always, Megan, the intention of this bill. It was not the save the business bill. It was the payroll protection bill program. Now they're saying, well, we get it. We understand that a lot of businesses aren't going to have access to credit after this. So maybe we'll let you use it over a longer period of time. It's really unfortunate that it came down that way, but we just have to keep watching the bouncing ball. So Megan, this is going to take a little while. They're not going to pass CARES 2.0 in a week.
No, I mean, again, this is going to be, since we've clearly seen just a Democrat proposal come forward and have, you know, kind of a lot of these, in some cases, pie in the sky ideas, it's going to take a while for them to negotiate to something that they're comfortable with. But they also know that they can't take months to do this. So, you know, what normally would take months or even years for us to negotiate, I mean, I am hopeful they'll do something in the next couple of weeks.
Well,
Megan, can I ask you a question about this? Based on, you know, if you look at your crystal ball, you know, we all have our crystal balls, but when you look at your crystal ball, based on what the Democrats are putting out, do you think it's a foregone conclusion that the 8 weeks will be extended? It might be 10, it might be 12, it might be 9, who knows, it might be 24. But do you think, based on your experience, that it will get extended one way or another?
I have a hard time believing that it won't get extended in some way, but again, it depends on what we fall on. If the Democrats decide to fall on their sword for funding to state and local governments, as opposed to the PPP program could be the negotiating thing that they don't. But again, it's not just Democrats who support the extension. As we'll talk later about Senator Rubio's comments and other, you know, Senate Republicans who agree that there should be flexibility on the 8-week period. I have a feeling that there will be some extension, yes.
See, my biggest fear, everyone on this panel, and Megan and I chatted about this a little bit beforehand, is let's say, everybody, you decide that you need this money as your lifeline. You want to pay your employees, but you're not going to pay them until they come back in your dental office, and this is your working capital, and this is what you're going to do. And if you wait 6 or 8 weeks to use this money to pay employees, and they stay on unemployment, is the government going to penalize you? They haven't given us guidance. They haven't said what forgiveness looks like. And it may be that you have to look at this money, folks, and say, yeah, the forgiveness would have been nice, but if we're going to expand it to a 5-year payout instead of a 2-year payout, at what, it's still at 1%, right?
I believe so. I was looking to see if I could see it alone.
Yeah, we didn't have a lot of time. So it may be that you have to do what you have to do, but again, the intention of the bill is for you to spend this money on employees and get them off of unemployment. What they're going to say in this guidance is, well, now wait a minute, you didn't spend this money for 4 weeks. You kept everybody on unemployment, and now you're going to spend this money over 8 or 12 or 16 weeks. Are they going to penalize you? I can't see it, but we don't know. And I can't tell people hang on to this money because you're going to get the forgiveness. They're going to come through. They understand. We can't base advice on that. So we'll just continue to watch us. I know that Eide Bailly and HMWC, Scott and I are on top of this. Megan is, I mean, I swear to God, Megan, you're amazing. Like the second you get something, it goes to us. We appreciate it more than you will ever know. It's just fantastic that we have this, like the Who Wants to Be a Millionaire. You're my lifeline on this, you know? So anyway, and the other thing about this employee retention credit, like I said, is that before it was that if you were getting a PPP loan, you couldn't take this employee retention credit. And they said, and again, I made this up about 9 o'clock last night, California time, this slide, that the PPP would be used with guardrails. So we'll see. Let's go to the next slide, please. Okay, so before we leave that, Megan, was there anything else? I think that was all you and I saw. Obviously, we'll just have to watch what happens and where this goes.
Yeah. On Idle, I just saw that someone put out part of the summary that they were going to infuse another 10 billion into the grant program, into the Idle grant program.
Okay.
I'm trying to find that in the actual bill text, but I haven't seen a lot in terms of Idle, in terms of the Democratic proposal.
Right. So let's go to the next slide, please. So last week, Megan sent me an article from the Washington Post, the sources inside the SBA. It indicated that EIDL loans that were in process. Remember last week we told you folks that you weren't able to apply anymore for an EIDL loan unless you were an agricultural or farming business, and that is still the case. That hasn't changed, right, Megan?
I checked earlier and still the case.
Okay, so the source who was not allowed to speak because they were not authorized to speak on behalf of the SBA, I believe is what the article said that they're now going to limit these loans to $150,000. So some of you are going to get the proposals. Many of my clients have gotten them. If you get this money, I'll tell you what, it's for working capital. It doesn't have anything to do with the PPP other than you can't spend it on the same things at the same time that you spend the money on for PPP. That's my understanding. I mean, this is working capital. Remember, folks, after this 8 or 10 or 12 week period or whatever they give us, 24 weeks, we are going to go on and we are going to continue. And, you know, how fast dental practices come back, we can only hope they come back faster and stuff. But if it were me and I got $150,000 payable at 3.75% over 30 years with no prepayment penalty and no fees, I take that money, I sign the loan documents, I use it for working capital, and I just keep it as my lifeline. I don't know, Scott, what do you think?
Yeah, I would take the funds. I mean, same position as you, Art, but I think reading the loan terms very carefully with your banker and your CPA, because I think there are some restrictions in there that you want to be very, very careful with that maybe we'll cover on a future webinar too.
Yeah, there's only so much we can do here. So, okay, let's keep going because I want to get to Ali because his information is critical also. All right, let's kind of put a bow around PPP. As we mentioned earlier, next slide, please. So as of May 10th, I think, Megan, they put out information regarding like May 6th or 7th, that there was $175 billion had been appropriated, had been used out of the 310. I think that was about 5 or 6 or 7 days earlier, if I remember correctly, they put it out. And then from that time until May 10th, it was 188 billion. So we've only had about $13 billion. So Dan, are you seeing your applications slow down here?
Yeah, we've seen it. Well, yeah, we've seen them slow down. Part of the reason was that we shut down our portal for a little while. It's back open now. But yeah, we did see a slowdown quite a bit.
Yeah, it has. So, you know, and the other thing that's interesting is that when you look at these numbers, a lot of the loans are going to the really, really small businesses. I mean, we're seeing, you know, 30,000, 40,000, 50,000 loans, whereas the average in the first round was over 200,000, which means that now a lot of the smaller businesses, maybe these are folks that didn't know what PPP was, didn't know how it worked, didn't have an advisor. You know, your corner your corner grocery store, your corner donut shop, your dry cleaner, the small businesses, that they started applying for this money and they started getting it, and the amounts, and a lot of people who were going to apply for this have already applied for it. So I think it sounds, Dan, it sounds like there's still, I mean, it's not too late to apply for this now, right?
Oh, absolutely not. In fact, I've had over the last couple days, probably 10 plus people contact me, and the day of, we're sending them loan documents and funding a few days later. So, yeah, we're definitely open. Again, if you have any clients that are now deciding they want to do this, please have them reach out to me on my email address. I'd be happy to help them through.
So here's an interesting thing. I'm going to go back to the consultation I had yesterday with my large practice. I said to them, you know what? I said, I can't promise you this because we really weren't feeling the love for the PPP for them. I said, give the money back before tomorrow, before the 14th. And I said, maybe you just reapply again. Dan, can they do that? Can they take money that they got? This group got $350,000. Can they pay it back to the bank and then reapply in today, tomorrow, next week, next month? Can they do that?
You know, the guidance we've received is no.
No.
Reason being is once they get that money back, they're listed in the system as already having received a PPP loan, even though they've paid it back. So they're now they're kind of canceled out of that program and won't be able to reapply because the language of the law states you can only get one PPP loan. So technically they got theirs, they paid it back, and now they're out of it.
But that's not necessarily true, Dan, and I'll tell you why. I have a client in Orange County who called me up the other day, and he said, Art, I've got great news. And I'm going to say nationally known Bank One funded me $57,000 2 days ago. Nationally known Bank Two funded me $97,000 today. Nationally Bank known Three has called me 3 times and wants to fund $107,000. And I said, is Vegas open? We should just go.
Yeah, I mean, we've heard the same stories. I've had clients that have gotten 2 loans funded. And so there's some type of crossing the streams going on here where the system's not recognizing these loans. Technically, you're not supposed to do that. But there's some, for some reason, the system's allowing this to happen in some cases. So theoretically, that can happen. If they want to try it, they can try it. But technically, that's not supposed to happen. Again, this thing's being built as we run forward with it, and it's there's a lot of glitches and problems with it.
Yeah, I mean, this is an article I was reading on the internet yesterday. It said one prominent tax lawyer cited the entire process as they're building the plane while it's in the air. I mean, that's really what they're doing. It's available, so we'll see. Next slide, please. Okay, loss of tax deduction of forgiven PPP debt. Next slide, please. So the IRS, as Scott reported last week or week before, that issued notice 2020-32. Scott, that was not a lot of love felt along on that proposal, right?
Yeah, it was unexpected and it caught a lot of folks off guard, and including members of Congress. And so I think everyone is working very quickly to try to reverse this decision that the IRS published a couple weeks ago.
Now I saw U.S. Senate Bill 3612, Megan. Is that what the mechanism is to repeal, to say that is that the deductions are allowed, or is it going to be in this CARES 2.0?
It's in the Dem proposal as well. So yeah, I mean, there's bipartisan, bicameral support. Congress was really unhappy with this decision, and I don't know. I mean, I'm hopeful. When Senator Grassley and Congressman Neal, one from Massachusetts, one from Iowa, who are opposing, Democrat and bicameral, can come together on a letter in agreement on this, it's really hard for me to see how they couldn't at least reverse this decision, I would hope. But if not, I mean, Congress is going to overturn it in the next package.
Senator Grassley is the chairman of the Senate Finance Committee. So
and Chairman Neal is chairman of the House Ways and Means. So they're the tax guys. So
yeah. So remember, folks, Senate Finance Committee, all tax bills start in the Senate, right, Megan? Isn't that the financial bills, the tax bills start in the Senate? Is that right?
The tax bills, believe start in the house, whatever. They can introduce them whenever they want. Consideration
Okay.
happens in one chamber first. But yeah, I mean, they're the powerful guys.
Yeah, so House Ways and Means and Senate Finance. So when you see House Ways and Means and Senate Finance Committee folks considering something, those are the people that are going to put it out to the entire Congress. All right, next slides, please. All right, next slide, please. So yesterday, Senator Marco Rubio spoke to the California Association of Florida, the Florida Institute of Certified Public Accountants. So these are the things that he said. He said PPP was drafted in 4 days and approved in 6 days, which is the equivalent for our orthodontists on the call, or for those of you who do Invisalign, of straightening someone's teeth that you would normally do over 2 years in about a week. Is that a pretty good analogy? SBA is working on forgiveness clarity. Yeah, sure. Senator Rubio said that 95% of the forgiveness calculations will be simple. Maybe he's read Go Dog Go by Dr. Seuss. I don't know, but I don't see, Megan, and Scott, how these calculations can be simple based on the way the CARES Act was written. I don't know. We'll see. SBA does not want to be in the collection business, and they don't want the money back. That's what he said. They want, I mean, unless you committed fraud, which I'm going to say all of you on this call probably didn't commit fraud. They may need to extend the 6/30 deadline. Now that I think is for full-time equivalents, applying for PPP. I mean, we'll see. We just don't know yet. I mean, they may change the full-time equivalent calculation to allow for more time to get the same number of employees back on payroll. Maybe this 24 weeks, don't know. We may get clarification this week. And also, I may break the course record at Pebble Beach. Yeah, neither one of those things are probably going to happen, but who knows? That was sarcasm, folks, because Megan and Scott and Ali and Dan and I are all sick and tired of repeating the same. Doctor, we really want to answer your question, but we can't because we don't have the guidance. Scott, how sick are you of saying that?
It's becoming comical now. I'm starting to feel really bad.
Yeah, I mean, it's terrible. It's terrible. Treasury needs to, Senator Rubio said Treasury needs to clarify what a full-time equivalent is and how retirement plan contributions are calculated. Everybody knows that wasn't clear. So anyway, stay tuned, folks. I want to move on to Ali. So Ali Aramshian is a dear friend. I've known Ali. We've known each other, 20 years probably, Ali?
Yeah, that's about right.
Yeah, I mean, when my hair was the color of your hair, that's when I did. Ali is is based out of Northern California, but he works nationwide. Ali is a labor law specialist. He has this amazing company called HR for Health. And if you do not, and this is not an advertisement because I don't need to advertise what Ali does. If you don't have your HR house in order, you need to get it in order with all the stuff that's coming down. He's going to talk about. He also does, he has a company called Medical Dental Counsel. He does legal work for dental transactions. And I've asked Ali to come on. He and I appeared on a couple of webinars last week together. And he has been the voice of the California Dental Association. So I've asked Ali to come on and talk about the legal issues of opening your office and also how to talk to people. So Ali, we are going to take a couple of minutes. We do have a lot of California doctors on our call and who are going to be listening to our call. So for those of you that are not California doctors, this is still going to be good information. He is going to touch on what the California Department of Health laid out on Thursday. So Ali, the floor is yours.
All right, thanks, Hart. So yeah, just to give a quick summary of what happened on Thursday for those of you who weren't able to be on the Facebook Live and other webinars on Friday. So there was a very big announcement. It's something that we have been waiting for some time, as is kind of a running theme, as you can probably imagine, with almost everything having to do with COVID-19. But what was happening was we were in this environment where the federal government, specifically OSHA and CDC, were giving certain rules. And then we had the states, and then we had the counties. And the counties here in California have been really, really aggressive and haven't necessarily followed the state's guidelines. They've kind of done their own thing, especially the counties here in the Bay Area, and that has kind of trickled down to LA, Orange, and San Diego, amongst other counties as well. So what the California Department of Public Health kind of came out and said was very simply that dentists can open up to do a couple of things. One, to see patients that they had canceled during this COVID-19 shutdown, and then also patients that they felt were in need of emergency care, or that they could become emergency care patients. So very specifically, they opened up the door to being able to see patients other than absolute routine cleanings and things of that nature. That's still not allowed. And the reason that's still not allowed is because of the CDC recommendations, where the CDC is saying, please avoid any routine care. So if you have a patient that's not at risk, if you have a patient who, they just want a cleaning, but they have absolutely nothing else going on, and they're not a high caries risk patient, then that patient should be delayed, and you should not see that patient. Now, Art, as you know, and I've gotten immense amount of calls since Thursday from hygienists all over the state, and in fact, all over the country, which is that there's this real stress amongst them in terms of, do I open up? Do I, do I go back to the office that I'm working at? Do I not go back to the office? My doctor wants me to kind of come in. We'll talk about that in a few minutes, but just realize that as of this moment, you can see your patients. Now, there is one big caveat here, one huge caveat here, which is that if your county looks at their data with regard to COVID-19, hospitalization, infection rates, deaths, and they decide that you are not allowed to open up, then you're still not allowed to open up here in California. Okay, so just remember that. If your county's rules are more strict than what I just mentioned, the state of California has put out through this department, then you are still not allowed to open up for business.
Ali, I suspect in other states, it's probably similar. It may not be county by county, but what are the ramifications? I have had at least 5 clients call me and say, Art, I'm opening. Yep. I'm just doing this. Yep. What are the ramifications if you do this? And I mean, are they going to be looking? Are they going? What do you think?
Yeah, I mean, the ramifications are pretty dramatic, actually. We haven't seen anything actually happen, but technically speaking, it is a misdemeanor in almost every state to go against a local or state ordinance or order. And so it's technically a misdemeanor. Technically, if that does happen, you have to notify the dental board of your state and things of that nature. And so things could get a little bit out of control. But what are the chances of that? It's pretty small, unless you really are, spitting in the face of the local rule, kind of like Elon Musk is doing here in California, where you're just inviting trouble. But you're right that every state is a little bit different. Colorado, it's not the counties, it's the cities that are taking the lead in certain ways. In states like Texas, it's a little bit different. They're taking the lead from the governor. So there's a lot of little variances, but the good news is that I think we're starting to open up a little bit, which is really great before the announcement that you and Megan were just talking about, because a lot of people were feeling the stress of the 8 weeks and the PPPs, especially those who kind of were Johnny on the spot and got the loans very early in this process. Their 8 weeks is about to expire, in a couple of weeks. And so they're, really stressed out. So if this does actually work and it does get extended for any time of period over the 8 weeks, I think it'll be a blessing, and this, it'll be a blessing for many people.
I don't know, Scott, where are you in Colorado and in that area? Are the dental offices open yet, or are they?
We're open right now. We've been open for almost a couple of weeks now, but the demand is there from the patient base, but also I think the employment force is less excited to return to the office. So like you were saying, the hygiene department and other groups like that, I think that we're having trouble getting everyone back on board right now.
Okay. Mm-hmm. I'm sorry, Ali. So go ahead and go back. I just wanted to get.
No, that's great.
Keep going.
Yeah, but I think the questions we're going to get through in the slides, you know, and we can move forward with them anytime you want, Art. But I think those are the big kind of issues that Scott raised, which is I don't want to go back because I'm scared. I don't want to go back because I'm worried about health. I don't want to go back because I'm living with somebody who's immunocompromised. And we should go through some of those and how to handle them, because these are real concerns that the team has. I mean, in my wife's own practice, you know, she's a pediatric dentist, for those of you that don't know, and she's not slowed down by patient volume. They are all excited to come back. It's the team that, as Scott mentioned, that is what's holding her back. And the reality is that, you know, we're only as strong and as good as our teams. And so, you know, it's there's a lot of communication that needs to happen there.
So Ali, we have Nanette on the line who's helping us today from Eide Bailly. So just let her know when you want to move slides.
Okay, yeah, let's go to the next slide, please. So we talked about that. Let's go to the next slide. This is now this rule here is the one in California, Oregon as well, Washington. Some other states are kind of copying this. Again, it's that you can see patients that are clinically necessary, that were previously scheduled but not seen because of the shelter in places around the country. And then the second thing is the patients are likely to develop a dental emergency. So this is really, number two is really the one that I think, you know, a lot of people are going to rely on to bring in patients who are at risk, because, you know, we are total body health in dentistry. And so what happens in the dentition definitely, you know, impacts the rest of the body. So if you have a high risk patient, you have an elderly patient and things of that nature, you can count on this. Now, this is not an exact science, unfortunately. It's not a math problem. There's a lot of clinical judgment that needs to be in place here. And so just kind of keep that in mind as you're deciding who to bring back and who to not. Let's go to the next slide, please. These are the things that are generally considered sort of acceptable. Again, it does vary state to state, but topical fluoride applications, sealants, scaling, minimally invasive procedures are still kind of considered okay if, now here's the big kicker, what happens next is what's key. You can do these if you do the following, and let's go to the next slide, which is if you meet these minimal requirements. Okay, so let's go to another slide, please, as well. So one, you got to have adequate PPE and sanitation supplies. So what does that mean? What does it mean to have adequate PPE? It's one of those vague terms that you know, lawyers, you know, really love to debate. I'm not a fan of it, but here's really what it means. Let's go to the next slide. You should have 2 weeks worth of supplies of the following. So N95 respirators, face shields, goggles, surgical masks, and other infection controls for you and your team, every team member. And so if we're talking about clinical team members, so folks in the back, they should probably be wearing their N95 mask. Obviously, you're not going to have enough to change after every patient, but on top of your N95 mask, you should have your surgical mask, and that's what you should replace in between each patient. Technically, if they're wearing scrubs, they should be wearing a gown on the scrubs now as well, and changing the scrubs in between each patient. You know, it's pretty common practice in dentistry these days where those scrubs are not scrubs, the gowns are not taken off in between patients. Pre-COVID-19, it was sort of an infection control nightmare, but it was common practice in dentistry. Now the rules are much different. The CDC has recommended that those be changed after each patient. Some of our doctors are debating because they don't have enough. You know, maybe they don't change them if it's not soiled. But if you're going to stick to the recommendations and what's probably safe, doing it this way, I think makes sense. You know, there are ways of cleansing the N95 respirators. I read this really interesting report by the founder of the N95 respirator that set out ways of basically decontaminating it, and it basically came down to the one thing that I think most dental practices can do is use dry heat. It has to be a certain temperature and all those kind of things. So talk to your OSHA experts and talk to them about that. But you can buy units on, from Amazon and other suppliers, where you can pretty much put in kind of like hot towel, microwaves or whatever they're called, and you can put your N95 masks in there, and at a certain temperature, it does decontaminate. So just kind of use that potential strategy to reuse some of the N95 respirators. What's interesting, Art, is that the department, or OSHA, came out and said, if you've got N95 respirators and they're out of date, they've expired, we'd rather you still use those than to use just surgical masks.
Wow.
So I mean, there's a serious shortage of this right now.
Hey, Ali, I want to jump in. Megan
Please.
and I were talking. Apparently, Megan, Senator Susan Collins from Maine, there was on the news this morning, there was a Senate committee meeting where the 4 heads of the health groups were on testifying in front of the Senate. And I guess Senator Collins made a comment about dentistry, and you caught that, Megan. What did she say?
Oh, really?
Well, Senator Collins has been working with us, the ADA, to talk about oral health care, because she's one of the huge proponents for oral health care being essential health in the Senate. And so she wanted to ask where we were with CDC. So she decided to ask CDC herself, and she asked, if dentists are following ADA guidelines on infection protocols, strict protection measures, and closely examining and seeing decline of COVID-19 patients in their county, are these reasonable factors to consider for reopening dental practices? Dental health is so important. And the CDC director responded, we are working closely with ADA and dentists, and I would not disagree with the ADA guidelines. We are in the process of updating CDC guidelines, which will include dental practice guidelines.
Oh, that's terrific. That's great. That's great.
So the best thing everybody needs to do is probably watch the ADA website for any updates, because as soon as CDC updates the dental guidelines, I would think, Megan and Ali, they're immediately going to put them on the ADA news and the ADA website, right?
Yes.
You should be checking that like every day.
Yeah. This is great news. This is great news, because the reality is that because of the lack of great information from the CDC, people have been relying on their state and other kind of, guesswork, if you will. The toolkit that the ADA put out is absolutely fantastic and really sets the tone for what you need to do. But to actually hear it from the CDC will be a relief for a lot of people. And I think, and Megan, you probably agree with this, I think it'll really allay the fears of our teams, right? The hygienists and the RDAs. I mean, that's really who I'm most concerned about, because without them, our doctors are really in kind of a very vulnerable situation.
It's why we've been pushing so hard for the CDC. Yes, of course, we want the dentists and dentist owners to be protected, but we want the employees to feel safe.
Yeah.
If they don't come back, we don't have a workforce. And like Scott said, we can't support the patients that do want to come in.
That's exactly right. Yeah, that's exactly right. Yeah, and then the emergency rooms get filled and all that stuff. So it's a vicious circle. Let's go to the next slide. So all patients, this is kind of everyone knows this by now, but all patients need to wear face masks and or cloth face coverings. I would have extra boxes of face masks available. If a patient comes to your office and they don't have a mask, I think it's a good idea to have some extras available for them to wear on their way in. I know it's a small thing, but something to kind of remember. Next slide, please. You do have to screen all patients and all team members, and this kind of falls into 2 separate categories. With patients, we are recommending that before they enter into the office, you have someone take their temperature and go through the screening procedures. Now, there are recommendations that these screening procedures should also be done prior to the appointment. Now, some states have done this, some states have not. We're just taking the approach of recommending that you do it anyways, even if your state does not recommend it, because it doesn't hurt. The worst thing that could happen is for a patient with COVID-19, an active COVID-19 patient, to come into your office to even be treated or to be to go through this sort of screening process. So by having these questions asked beforehand, you can divert them to their physician or some other local medical facility as opposed to your office. And so be very careful about that. The ADA has a checklist about what questions to ask, and there's a really great document there. Some state associations like the California Dental Association also has a really great toolkit that has some good questions. So you can get your hands on this information. And if you can't, just reach out to me or HR for Health and we'll get it to you. Now, with regard to the team also, their temperatures also should be taken. And that information needs to be stored somewhere. So the Department of Labor has been very clear about this, that this information is confidential. It is highly protected information. So you need to treat it as such, which means that you need to store it safely. If you're already an HR for Health customer, it's easy for you. You put it on our system online and it's secure, and there's no issues there because it's all behind passwords and things. If you're doing it the old-fashioned way still on paper, then make sure you've got a separate sheet for every employee where you're documenting their daily temperature, and that is then stored in a separate file from their employment files under lock and key. Okay, so this is very important. It needs to be separated and it needs to be secured under lock and key. So if you're, let's say, office manager and maybe other managers have access to a file cabinet where it has their employment file, then this should be stored somewhere else where it's locked and only people like yourself as the owner and maybe an office manager have access to it. So just kind of keep that in mind. There has been a little bit of relaxation of some of these rules with regard to health questions that you can ask your team. Typically, you can't ask questions about their health, right? What's wrong with you? When are you, what does your doctor say? You can't really kind of go into details about people, your employees' health situations. With COVID-19, you can ask more detailed questions as long as it's related to COVID-19. We are seeing an influx of notes that employees are getting from their doctors, relieving them of coming to work for unknown medical reasons. They don't say it's COVID-19, they just say they're under the doctor's care and so they can't come in for a certain period of time. Under those situations, you still can't ask questions. Those fall under the older rules. So keep that in mind because it is kind of a risky situation. Let's go to the next one. Telehealth, this is to screen the patients. We had a good question actually last time, Art, about this. Telehealth doesn't necessarily mean it has to be on Zoom. It could be telephonic as well. But you could do it face-to-face or via video, I should say, like this, or it could be telephonic. But it should be done, prior to the patient being seen.
But they need to document it, right, Ali?
Oh yeah, absolutely. Yeah, document everything, like over document,
Right.
So yeah, absolutely. And there's, like I mentioned, the CDA, the ADA have these like really great set of questions. You can add your own questions if you want. The CDC actually put out some new symptoms, I think just over the weekend, or maybe it was Friday. Those are good things to add on there. Obviously the temperature, the dry cough, all that kind of nonsense is the typical symptoms, but the CDC has put out some new symptoms that you can ask about as well. So let's go to the next slide, please. Again, another small thing, but good reminders, having signs regarding hand hygiene around sinks, making sure you have signs coming into the office, leaving the office, common, lounges like the kitchens and things of that nature for your employees. Reminding everyone about respiratory hygiene and cough etiquette, I think is great. I saw something, it was either the ADA or the CDA put out something very recently on this, and I thought it was really great that you could just print and put on. So I think, again, reminding your employees of these things, I think, is important, and the patients. Having hand sanitizers on the way into the office, on the way out, next to each operatory, things like that are advised now for the team. Let's go to the next slide. Okay, so equipment, let's go forward one more. So to minimize aerosol, these are the recommendations that we're seeing come out for you to kind of keep in mind as well. And this is really great for the team, for the team's sake, and also for your communication. Using rubber dams, doing four-handed dentistry, having high evacuation suctions. By the way, they're not all created equal. Gordon Christensen has done a really great analysis of some versus others. So I would recommend kind of looking into that. And anything else that can capture spatter and aerosol, I think is probably a good idea to put in terms of aerosol generation. Let's go to the next slide. Remember, you do need to be fit tested for your N95 respirators. So there are local companies that are doing this. It's not terribly expensive, but it is, there is a cost associated with it. Usually, you can get your entire team together and they'll come in and do a fit test. This is a requirement. We don't know, you don't need to do the yearly one, I think is what has, come down from the CDC, but in terms of the initial one you do. Something that's tied to this is also very important, and this is a liability issue, is you want to get, you need to get a sort of a health exam also for your employees, that they can actually wear the N95 respirators. This is important because of the CO2 levels that increase when somebody's wearing a mask. And so if they are older, any sort of immunocompromised situation that you may or may not know of, then those CO2 levels can have a serious impact. And so getting a health screen and kind of a waiver or permission to wear these, I think, is important for your team. And also you want to make sure that your team recognizes the symptoms of increased CO2 levels. So, migraines, blurry vision, loss of the sense of taste or smell, those kinds of things are things that you should be educating your team on in advance of opening up, if you haven't opened up yet. And so, so just kind of remember that as best practices, because it is happening. I mean, it is. I'm sure you guys have probably all seen some of the articles in the Wall Street Journal about runners who are wearing the mask and they're like passing out, and so we're not running, but it is an active environment. So let's go to the next slide. If you don't have N95 masks, there are protocols in place to wear a surgical mask and then wear a face shield on top of it. It's not protective at all compared to obviously having the N95 mask. So this should be like a last resort. We wouldn't recommend you seeing any patient other than emergencies if you don't have an N95 masks. So if you have to wear one, go ahead and wear one with a face shield, but just be aware of the risks there.
Hey, Ali, so that's been the biggest question I've got, is people are scrambling. Megan, I know ADA is working tirelessly to try and, have they had some success?
Well, we did get FEMA to recognize that dentists and the dental profession should be fourth in terms of importance of distribution for any sort of PPE, especially N95 masks. And actually this bill, I was just reading parts of it, does include a provision that would require them to appoint someone to oversee the distribution and supply chain for PPE, most specifically N95 masks. So yes, these discussions are ongoing, and we are pushing not only at the federal government, but any distributors or private suppliers that we can to ensure that these get to dentists.
Did you see anything, because you've looked at this thing more than I did? Did they do anything about a tax credit for PPE?
I was digging through that to try to see. I couldn't find it in time, because that was another thing, of course, that we wanted to look for, but I didn't find it in time. So I'm still looking for that one.
All right. Okay. I'm sorry, Ali.
No. This is great. Yeah, this is one of the, I think, the most difficult situations organized dentistry has been in, because I think the ADA, CDA, various other states have worked so hard to try to get these N95 masks for their members, and the reality is that it's nearly impossible to get your hands on it right now. The supply chains, I've heard, Megan, are starting to ease a little bit, but when the federal government comes in and takes all the masks and wants to give it to hospitals, it's impossible to get your hands on them.
I mean, Ali, we had this thing about a month ago where 1 million N95 masks were delivered by trucks to the CDA in Fresno, and they were going to be distributed to all dentists. And our governor said, no, we're taking those masks back.
Yep.
The
Yep,
thing
that's
that bothers
exactly.
me the most are those dentists and dental practices that donated their N95 masks at the height of this crisis because they wanted to, give the frontline workers the protection they needed, and now they can't find the N95 masks themselves to open up their own practices. It's no good deed goes unpunished in this instance.
Yeah, it's funny you say that, Megan. I had a doctor who had a large stash of N95 masks, like way more than he needed. He had just had them for years, and so he goes and he donates it to the hospital, his hospital in his county, and they ended up not using them. They didn't have the influx. There was like almost no patients coming through. So now that he's getting ready to open up, he went back saying, "Hey, you guys didn't use them. Please give them back." The hospital said no. So it's a shame. It's a shame. It's a shame. So let's go to the next slide. Okay, some final items here, and we can go to the next slide as well as we kind of end up, take a look and pay really great attention to your local stay-at-home orders. They go by different names, but the county orders are really, really vital across the country. We are already seeing a little bit of uptick in some states that have opened up their doors. And so through some relationships we have with the Chamber of Commerce, we're getting information that there are, talks of some cities kind of clamping down again a little bit more than maybe they had previously. So there is talk of that if these numbers increase. So pay really close attention to your county orders or your city ordinances as well. Let's go to the next slide. Making sure you're limiting the number of patients in the office at any one time, having plexiglass, in your reception area in terms of to protect that guard, and if you're in an open bay environment, having plexiglass in between chairs, I think is not a bad idea. Remember, you're not going to do the same volume as you did before. It's almost impossible based on some of these new rules. And so getting creative with your scheduling may be an option. And so make sure you communicate really well with your team, because we have doctors that are going from 8 hours to 10 hours to 12-hour days. And what they're doing is they're having a sort of a morning team and an afternoon team with a little bit of overlap in between. So just, be creative about that if you need to, because if you've got the team and you want to, try to make sure you're tending to all your patients, you may have to kind of work through some of those things.
Ali, yesterday on this meeting I did with the clients and the coach, I said, listen, if you're only going to be able to be open 25 to 50% of capacity at any one time, that I said, let's open this up an extra hour and a half a day. Let's open it up on Saturday. And we figured out the math. We're going to be able to bring in, because they have a lot of patients, $70,000 a month more in revenues, which is huge at this point if you're only open. I mean, so yes, doctors, if you're limited and you can't see as much until we have a vaccine and until we get back to some sense of normalcy, this is going to be the new normal, and you may need to look at people working staggered hours, like you said, Ali, and there's nothing wrong with that, right?
Yeah, no, there isn't. And it might also protect the office, because let's say, God forbid, one employee or a patient gets sick with COVID-19, you may not lose your entire team. You may lose, half of your team if you're doing a staggered schedule, because you could, in theory, close the office, scrub everything down, and you still have half the team that may not have been exposed. So remember, the CDC guidelines in terms of the 14-day quarantines are still in play. So if someone gets sick in your office or a patient comes in and they infect, there's a very real possibility that if you don't have these sort of A/B teams or other things, you may have to close down the office and quarantine everyone. So I think the CDC guidelines, hopefully, that are going to come are going to provide more information on some of this, but this is a very real thing. So. Let's go to the next slide. Okay, we talked about that. Let's go to the next one. Just some basic, kind of recommendations. Make sure that you're cleaning and disinfecting every room after every patient. Some offices are already doing this because it is, kind of infection control rules that were previously in place, but you should disinfect the rooms. Make sure you're training the team to do it consistently. I think spending the time to educate them on the importance of this, although it does take extra time, definitely is recommended because they have to do it consistently. It's easy to kind of fall on bad traits there. You can use cleaners and other water products to clean surfaces before you use an EPA registered hospital grade disinfectant. So make sure that, if you are going to use that, you're not just using water or some kind of general cleaner, that you are using an EPA registered one. If you have any questions, it's Schedule N as in Nancy, on the EPA website. You can look at that, and that schedule has all the EPA registered hospital grade disinfectants that work apparently against COVID-19. So kind of keep that in mind as well. Next thing, okay, so the most important thing, and we've talked about this a lot, and I think it's a running theme here, is please communicate with your team members. I saw something last week from a hygiene association, I think, survey that they had done, and they said 60% said that their doctors hadn't communicated with them at all since they went under shutdown mode. And so that is a crazy number of people who, don't have any information. And so I think personally, based on all the conversations we've had nationwide, is that it's all about communication or lack of communication that is causing this fear and this, this sort of upsetness, if you will, amongst the team, because they don't know what you're doing. I think a lot of them don't realize all the efforts you're taking in place in terms of putting PPEs in place to protect them. They may not have access to a lot of these kinds of webinars that you're attending. And so I think communication is really the key here, and most likely will lead to honest conversations about who can come back and who can't come back. At the end of the day, of course, if you have work available and you're offering to somebody and they refuse to come back, you can terminate them, but don't take that lightly. Make sure you're contacting someone like me or someone else who's on the employment side, and let them advise you through it.
So are you going to get into that subject now a little more?
I think so. Yeah. Let's go to the next slides. Yeah.
Big deal. Big deal.
Yeah. Big deals. Yeah. Let's go one more slide, please. Oh, actually, I guess not. Let's go back. Let's go back one slide. Okay. So let's talk about the three top questions we get, which is, I'm fearful of returning. I am, I'm fearful because of COVID-19. I make more money on unemployment, so I don't want to come back, right? And two, I don't have childcare, right? I don't have childcare, and
those are the three questions. Yep.
And so those are all very real, very honest, very difficult questions, and the reason is they're difficult is because we're all in the same boat. We understand that this is not someone who, wasn't thinking ahead. It's just that, schools are closed, daycares are closed. They don't have access to daycare anymore. Maybe their spouse or their mother or someone who's elderly, can no longer, treat or take care of the child. So these are all very real things. And my advice so far has been very simply this, that if that employee is of value to you, if you value their contribution, if you want them to be part of your team after this crisis is done, then having a little bit of understanding and being a little bit more flexible during this crazy time, I think is probably the best practice. And what I mean by that is give them the time, talk to them about what it would take for them to come back. If it's an issue about being fearful of COVID-19, I think spending the time to educate them on what you've done to protect them, I think will work really well. Sometimes it's enough, sometimes it's not. My favorite question to ask is there anything else you would want me to consider doing with regard to PPE? Let them tell you. If they have some great idea about something, and it might be an air filtration system, it might be something easy that would entice them to come back, ask them that question. Of course, if they say, no, you've done everything I could possibly ask for, then it's a lot harder for them to not want to come back. when you've done everything possible.
I mean, I'll let you say, Susie, you are an incredibly valuable member of our team. I don't know what we would do without you. What can we do to make you feel safe? And the answer may be nothing.
That's right. That's right. Yeah, that's a great question. Yeah, it's you know, asking those kinds of open-ended questions so that they tell you what they need. But you're right. I mean, I think where do we see this report? There was a report by an economist with regard to dentistry, and it said that 20 to 25% of patients they believe will not return to a dental practice within a year. So you know, that doesn't, you know, that's a fourth of potentially your patients that are not going to come back based on this report. So if that's the case, then it's fair to assume that maybe a fourth of your employees will not come back.
And that's why it's so important for you, while your offices are closed, doctors, to communicate with your patients, because your patients don't know. They just think dental office, aerosols, I saw something on TV, I'm getting COVID-19, I'm not going. But the fact of the matter is if you do this right, the dental office is a safe place.
That's right. That's
right. But they don't know that. They don't know what the dentists do. And you know, so that's so important to communicate with them. That's why I've been saying, Scott, you and I have been saying for weeks, doctors, start calling your patients one at a time. You're going to be out for 2 months, call your patients, get on the phone, communicate, let them know you care about them. Let them know that when they come in, they're going to be, well, they may not be welcomed with open arms. They'll be open virtual high five or something. I don't know. And basically we need to educate them, just like you educate your patients. Ollie, we've been teaching for years about why do you need a crown and why is brushing and flossing wrong. It's the same thing. Now we're just educating them about, we're in a new normal. This is what it is, but we have taken this to the next level.
Yeah, that's right. Yeah, and I always, you know, I've been saying, you know, treat your employees like you're treating your patients. In other words, you know, when you're doing TikTok dances and Facebook stuff, educating the patients about what you're doing to protect them, don't forget about your team. They need the same love. They need the same attention. They need the same information to feel good about coming in. And, you know, everyone's threshold is different. And I was scheduled to be on the road giving lectures nationwide, whether it was at the ADA or other conferences, you know, 180 times this in 2020, Art. 180 days of travel, you know, of just speaking at places. So when you think about that number of days, now, will I ever go on an airplane and travel that much? No, probably not. There'll be like a handful of places. That's my threshold. But for somebody who's in a dental practice, their threshold will be very different. And it could be that they might be okay with traveling, but they may not be okay with the aerosol. So what I'm getting to is that I think the education side of things, as you said, is very, very important. Show them what you're doing. If it's a fear thing that they're concerned about. Now, if it's an unemployment thing where they're making more money on unemployment, well, that's a little bit more difficult because in one sense, you know, it's hard to say, come take more risk to your health, come do all these things. And by the way, you might make less than you're making on unemployment, especially now that I think, and Megan, maybe you can touch on this. I heard that they might extend unemployment through the end of the year with the $600. Is there any truth to that, or have you heard anything about that?
I just read one of the summaries that says that this bill is proposing to do just that.
Okay, so
wow. Yeah.
So it's going to make things even more difficult because instead of it being July 31st, now it's, you know, it's December 31st maybe.
Now, Ollie, let me throw this at you. I've gotten this question at least 10 times. Scott, maybe you have too. So Susie comes to Dr. Aramshian and says, now, Dr. Aramshian comes to Susie and says, listen, I need you. I really need you back. I know the unemployment. Here's what I'll do. How much more are you making on unemployment than you were with me? $200 a month. All right. You know what? For the short term, until we get back to work, I'll give you that extra money. What do you think about that, Ollie? I've heard that at least 10 times.
I don't mind it. I mean, personally, I'm okay as long as it's in writing and it's for a specific amount of time to get them to come back and to treat the patients and get sort of our, you know, businesses going. I'm okay with it. I think the next question after that is even even more crucial, which I'm getting, and I've been deferring it to you. I think you've seen those emails, which is that extra bonus or that extra compensation forgivable as part of PPP?
And yeah, Megan's, you're doing what I'm doing. It's like, we don't know till they give us the guidance.
Yeah. Yeah.
And
That's
I would
exactly
hope,
right.
I mean, I'm hopeful that they would allow people to give their employees bonuses. I mean, the whole point of this is to pay people. So I can't see that being a restriction, but again, we don't know until we get the guidance.
I mean, I've given out, we've sent out, and we have our PPP planner spreadsheet. If any of you want it, just email me, artwiederman@gmail.com. You email me at art.wiederman@hmwccpa.com, and that's on the last slide. And we've given out, I mean, hundreds and hundreds of them to dentists all over the country from the podcast and everything that we've done. And what's happening is, a lot of times the way this formula works is that there's money left over at the end. There's you get a $75,000 PPP loan. We're seeing 5 or 10,000 left over at the end. And then the question is, what can we do with that, Megan? We can give it back to the bank. We can turn it into a 1% working capital loan, or maybe we get to give it as a bonus to the employees. We don't know yet.
Yeah, we don't know.
One of the things I'm interested in seeing in the guidance, actually, Ali, or other guidance, is if there's going to be a mechanism for which an unemployment office asks the former employer if the offer of the job to be rehired happened. And if so, they will have to be obligated to report they did offer to rehire, but the employee decided not to, which then puts the employee in a potentially fraudulent position. And I think that's something that we always have been reminding our dentists. It's not, you don't need to lead with that, but you'd always need to make your employees aware that if you offer to rehire them and they say, nah, I want to stay on unemployment, that they are on the hook if they are then caught for not coming back to work.
And that you as the doctor are obligated to be honest and truthful, even if it's not going to be in the employee's favor, right, Ali? I mean, we have to be truthful, because the state comes back to them. There's penalties and fines, and
There is. And to your point, Megan, almost every state sends out these documents every 2 weeks and asking whether employment was offered and things of that nature. And that's, I think, what the employees don't realize, is that if the office is open and they are offered their position and they say no because they're hoping to be on unemployment, they will lose their unemployment in many situations. And that's a difficult place to be.
And then may not have a job to come back to because they decided not to come back and the dentist decided to hire somebody else.
That's right. That's right. When you burn that bridge, it's very hard to rebuild it in a short time.
I mean,
so
sadly, 33 million people in this country have filed for unemployment. There are a lot of people out there. I am in no way, shape, or form suggesting that you clean house, but if the situation comes and Susie was a marginal employee at best, and this might be an opportunity, Ali, to do what you need to do under the law.
Yeah.
Okay.
Yeah. Just don't do it. Just don't do it by yourself. Call us. We'll walk you through it. Yeah.
Folks. I'm gonna. Ali, you've allowed me in the last 2 or 3 webinars we've done together to give some legal advice. Art Wiederman, CPA attorney. An acceptable answer, if you don't know what to say to Susie, is, Susie, that's a great question. I'm not prepared to answer it at this moment. Let me get back to you, and then call Ali. Right?
That's exactly right.
Thank you. See, there you go.
Yeah, you're honorary JD. Perfect.
I am an honorary JD, as you are an honeither CPA. Megan is an honorary like everything. So there you go.
I'm not smart enough to be honorary anything. So.
Me neither.
All right, let's go to the next couple slides as we end it today. So here are some really great resources. The ADA toolkit is fantastic as a jumping off point as you plan. The HR for Health opening guide is really great in terms of your employees, what to do as in terms of hiring, the documentation you need. Please remember, if you have terminated your employees during the COVID-19 crisis, you need to hire them all back on using all of the normal forms that you would. And there's an average of 12 to 17 nationwide that you need to give to every single employee. So some states are closer to the 12 and some states are higher. It just depends, but make sure you give them that. Make sure you get them an employment manual that's updated. There's a lot of new rules in terms of anti-discrimination and documentation and things that need to happen. So So let HR for Health know, and they'll take care of you there. And of course, the CDC guidelines are there. They will be updated, it sounds like, from what Megan's saying. So keep an eye out for that. But these are really great resources for you right now that you can rely on. But as I mentioned earlier, there's a little bit of professional judgment that must be used. And so you're not going to get answers to every single question you have. You're not going to see in many places, facts about how many gowns you should have, but you just need to use your professional judgment based on the recommendations that they're making for infection control. Let's go to the next slide, please. And then one more. So if you guys want sample letters that we have put together for you to give to your team members, whether they were furloughed or terminated, if you text the word COVID-19, just one word there, to that phone number 44222, you will get a text back asking for your email, and then once you reply, you will get the documents in your email. There's no strings attached to this. This is just as a gift for all of you. You'll also get links to our resources page at HR for Health. So there's a lot of amazing material there in terms of checklists and other things, including the ADAs, the CDAs, and some other really great ones that we've seen. There's a PPP calculator that we're recommending as a guide, to go along with what Art was mentioning. So there's a lot of great info for you to have there as a jumping off point. And then we can go to the next slide. And I think that's just my info. If anybody wants to reach out to me, please feel free to call my office or email me, and we'll follow up. But that's it. So thank you all.
Nanette, let me ask a question. Do we have to be off at 12:30 sharp?
No, you can continue. I know you guys have gotten a lot of questions that have come in.
Yeah, that's why I want to hit some questions. Does anybody have anything else? Let's start on the questions, Ali. If we can go a little over 12:30, that would be wonderful. Okay, let's start off. Are you aware if employees can come back now on reduced hours with the PPP and still get the federal unemployment $600 bonus through July? I don't know the answer to that question, Ali. I mean,
where's the question? Actually, I missed that.
If you press on Q&A at the bottom.
If you're aware if employees can come back now on. Oh yeah. So the way it's actually really written really interestingly. So the one of the first versions of the bill that I saw said, or maybe it wasn't the first version, but it was a couple of versions that I saw said up to $600. So we thought that it might be reduced, but the final one, the one that got actually passed, doesn't say up to, it just says $600. So our understanding is that if you're on unemployment at your state, whether it's partial or full, that you might get the $600. But Megan, what do you think about that?
Well, the whole intent of CARES was to get people off of unemployment. So you might be able to receive partial, but we're still waiting. Again, this is one of the things that I think would be clarified in the guidance. I would have a hard time believing that they'd want to move forward with giving people this extra $600 while they're also partially employed and while they're also receiving partial unemployment. I think you may be able to receive partial unemployment, but I would imagine that $600 would go away if you get rehired.
I would think so too.
That makes sense, yeah.
Okay, question for Ali. In order to bring back an employee who has been on fixed salary, is it possible to calculate their hourly rate based on their fixed salary divided by their regular hours and pay them hourly on limited hours between now and when you're ready to reopen?
So the short answer is yes, although you need to do this well in advance. And so if somebody is on a fixed salary, if they work even 1 hour for you, you need to pay them their entire weekly salary, regardless of how many total hours they work. But you can have a conversation with them and switch them to hourly for a specific amount of time, but you've got to make sure that they accept that and that the hours are and the hourly rate are understood. And if you do all those things and you give them enough notice, then the answer is yes.
Okay. I got one PPP from a smaller bank, less amount. Then I got my regular bank funded a higher amount. I'd say take them both, go to Vegas, put it on, black on the roulette wheel. Megan, would that work? Can't do that, huh?
I mean,
I'm not feeling the love here, No.
Not if you don't want to be facing incarceration later.
Yeah, that's right. That's right. One PPP loan, folks. My client that got the 2 of them, I said, you need to return one as soon as possible. 1 per customer, no exceptions. Let's see, can I take a bigger loan and return the smaller one? Yeah, if you've been approved for both, you can only take one. I guess you can, right? I don't think it's anything else. So where does Los Angeles County stand? What are the loan box and sign? Who will change the law of the 8-week well, the 8-week versus the 10 versus 24-week? That's going to be Congress, and that'll be in the next month. Do you know where LA County stands, Ali, as far as opening up? I don't think they're ready yet.
No, I don't think they're ready because they're seeing upticks in their numbers. I would say, with LA County, I would follow the state rule right now that the Department of Public Health kind of put out, but I'm not sure exactly where they are right this second. It's changing literally daily.
LA County's website.
Yeah.
Let's see. Is there any talk of a liability shield to not hold dentists liable for any attempt to suggest infection in a dental office by a patient?
So I guess I can talk about that a little bit. So, the workers' comp will step in if a patient, let me rephrase that. Workers' comp will step in if an employee gets COVID-19 in the office. If a patient gets COVID-19, then your general liability insurance should be stepping in to cover you. I don't know, Megan, if there's anything else that Congress is working on. So.
Yes, actually, Senator McConnell, who, as you guys know, is the majority leader in the Senate, is working on a package of virus-related liability reforms for coverage for patients and also providers. And so there's various proposals being put forward. We're monitoring them to see which one would be the most beneficial for ADA members to support.
And that's another reason that if you have a business interruption policy, as we talked about last week, would be to file a claim, because if the federal government passes legislation and you haven't filed a claim, you may not be eligible to get benefits. We talked about that last week. Can the staff sign a consent form for an off-site temperature taking at home before coming back to work, Ali?
I definitely would not recommend that. No. This is like, giving the wolves the key to the hen house here. You have to remember, you want to protect your patients and your teams and whatnot. So the doctor or the office manager should be the ones taking the temperature before they walk in to make sure that they really don't have it. Remember what happened in South Korea, was it, over the weekend, where a gentleman went out because they eased the rules and he visited 7 bars and nightclubs and infected something like 70 people.
Oh my God.
And they went and infected 40 other people or some variation of that. And now they're because of that, they have shut down again bars and nightclubs. So it's just, you got to do it for your own protections. It's not about the employees taking their own temperatures. So.
Let's see. Would a Google form document be secure for these purposes of employee screening?
If it's password protected, where no one has access to it other than you, then yes. But I from my understanding of how Google Form works, it's not super secure, and I don't know if it's secure on Google either. I don't know if it's a secure site where you've got encryption and various other things. But
there might be
my gut says I feel like it's not, because on HR for Health we're super encrypted, and I don't know that Google would be like that. So,
okay. Can a level 3 mask be worn without a face shield?
If you don't have any N95 mask and you're only treating emergencies and it's an absolute emergency, you absolutely must do it. Yes. In other regards, I would say stay away from it because it provides no protection for you.
Okay. Can we charge patients for PPE costs? I believe we still live in a free country, right?
They're yelling. Now they're yelling.
They're yelling, yes, in capital letters. We must charge for So I know that some of the insurance companies have said that they will allow, and we have that new code, was it D1999, that ADA has put out, Megan, which is for PPE costs. I also know, this is interesting, and hopefully I'll have maybe some information next week. We're actually taking we're asking all of our clients in the ADCPA as how much is the average of your cost of PPE equipment. It'd be interesting to see what people are saying. We haven't got that information yet. But yes, you can, I mean, there's nothing that says you can't pass on increased cost in running your business to your customers. I don't know, as a business advisor, Scott, maybe you jump in on this one, is to me, I would just build it in. And again, if you're contracted with an insurance company, it's a different conversation, but you might just build that into your fee. I wouldn't say, by the way, we're charging you an extra $15 to cover these PPE costs. People think you're double dipping, you're nickel and diming, you know what's going on. Whereas if you just build it into your fee, I don't know, Scott, do you have any thoughts on that maybe?
You know, like you said, it's a legitimate operating cost, part of doing business, and you know, they're not, the docs aren't the ones that are creating the infection and all the rules, and they're just trying to abide by them. So I think that everyone has to understand that we all got to chip in on this together.
Okay, one of our clients. Where are the PPE requirements published? I believe the California Department of Public Health guidelines do not mandate N95 masks.
Yeah, there's no, these are all recommendations. There's no, they're not mandates, but I mean, you can take them as, you know, I mean, you can take them as law. I mean, they're not, you know, they're not making it for their own benefits.
Okay, FDA released statement 65 out of 80 previously approved are not functioning and failed testing against COVID-19. Please note, check to see if your masks are authentic. I think this is more of a comment that they're saying that some of these masks are not good. I don't know. I mean, it's like what they say on 60 Minutes. A lot of the tests are not, I don't know.
Yeah.
We have an RDH who is pregnant and she is due on September 9th. She is afraid and doesn't want to return. She wants to stay on the temporary unemployment paycheck in California. Should she get a document from her doctor to stay on that condition? Can we just keep her on furlough and hire somebody else? We get that question a lot.
Yeah, we do. Yeah. So if someone is in that position, they don't wish to come back, you know, that's okay. You can get documentation from a doctor. You are not allowed to delay the start date of someone who is pregnant, older, or immunocompromised in any way. But if the patient doesn't want to and they can get a doctor's note, I'm sorry, if the employee doesn't want to and they want to get a doctor's note, that's totally fine.
Okay, in regards to compensating the employee's pay with the difference of the unemployment amount, I heard it would be okay, but Ollie would want it in writing. Well, Ollie wants everything in writing. That's right. What they teach in law school, right?
That's
no
right.
problem on that part. My issue is, what if you have 4 employees and only 2 qualified for unemployment? Can the 2 that were not eligible for unemployment legally sue for discrimination? So the question is, I've got 4 employees, 2 are on unemployment, 2 are not. You give the $200 a month raises until they come back to work, and the other 2 go, oh, wait a minute, I'm not feeling the love here, and there's discrimination.
Yeah, this is a great question. This is a great question. Yeah, I mean, I think I wish I knew who it was. I mean, it's anonymous, unfortunately. But yeah, no, this is a wonderful question you're asking, and I think you're right. I think that it could cause some potential problems if you're, you know, paying some and not others, yes. Especially if you're basing it on simply the fact that unemployment was received. You're right. It is kind of crazy why some people have gotten unemployment and some people have not. There's really no rhyme or reason in many states. But what I would tell you is that to be safe, if it is like, let's say, a $200 difference, and that's the number you're going to give to those that got unemployment, I would just give that to the other.
Give it to everybody. Yeah, then you can't be wrong. Is there a temporary suspension the same as terminating an employee?
Not necessarily, but I don't know if this is the right question. I think maybe the question they're trying to ask is whether furloughing is the same as terminating, but furloughing is not the same as terminating. A temporary suspension is also not the same as terminating, unless you know, unless it lasts for a certain number of days. But I think, Glenn, if you want to call me on that, we can chat, you know, separately. Okay.
If I only got $20,000 for PPP, but I have 5 employees, Would it be better to give back the PPP loan and do the employee retention credit? First of all, I think that your calculation maybe wasn't right, or the bank didn't get it right. But if all you got was 20 grand, if you have 5 employees, especially if we have the new enhanced ERC and you meet these rules, you could end up with as much as $60,000 in tax credits. It sounds like that might be the way to go in that particular situation. But I'm concerned as to why this particular doctor only got 20,000 if they have 5 employees, because the math doesn't work. I've done enough of these calculations, but in your situation, yes, it would be better to probably take the ERC. LA County just announced that stay-at-home orders will be all certainty will last through July. Mayor Garcetti's been very conservative in what he's doing. Let's see. Can I explain how the EIDL grant will be deducted from the PPP forgiveness? The EIDL grant will be deducted from the PPP forgiveness. Basically, if you got $100,000 and the bank said $100,000 was your forgiveness and you did everything right, and you got an additional $6,000 grant, then your forgiveness would be $94,000. That's how that works. I got one right, Megan? Yay.
You get them all right, Art. You get them all right.
No. So what happens is on these things, if I get one wrong, Megan just texts me. So that's right. That's our little signal. Okay. Principal insurance is reimbursing $7 for each patient visit. Okay, that's good to know. Hey, I learned more from a lot of our dentists than I'm teaching here. It's great. If my wife's dental practice and my independent contractor job as a dentist somewhere else uses the same EIN number, can I apply for 2 PPP loans using the same EIN number? Well, let's see. My wife's dental practice and my independent contractor job as a dentist somewhere else. I don't know why, as an independent contractor, you'd be using the same EIN number as your wife's dental practice. You would probably be using your social security number on a Schedule C. My guess would be you probably couldn't, because I would think, Dan, I know we haven't come to you much, but if someone had a dental practice and then an independent contractor and they both had the same EIN number, would you make them 2 PPP loans? Is it based on the EIN number?
It's based on the EIN. So if they have separate EIN, so if they have one on their social, one on a different EIN for the company, yeah, theoretically, yes.
Okay.
I had this come up with a client, actually. He had a different source of income flowing through to him for services with a company, and that was going through his S corporation. So it was all hitting the same EIN. So I told him, if it was on your Schedule C and your social number or a different EIN, more than likely, yes, you could apply for that separate loan. But if it's all combined in that one EIN for different services, I think you're stuck at that single entity level.
Okay. Where can we find a list of fit test companies? Is it better to get the in-office kits if available? Does anybody know anything about this? I don't.
They're available online. You can buy them from various groups. It does require kind of a process. So if you really want to do it yourself, you can. But it's only a few $100s, I think, to get fit tested. So it might make sense to go down that road if you can find someone.
If your business insurance has the virus clause, won't they deny any claims if you are sued? Yes, they probably will. Would your professional liability cover it? I'm not qualified to answer that, but here's what the whole thing is on the business liability is if your policy has a liability, has a virus clause in it, what the claim is that your business was not damaged because of the virus. Your business was damaged because a government agency or entity required you to close your business down. And that's what these lawsuits are about. So I had Randy Curry on last week. Randy's my go-to guy. If you need Randy's number, email me. I'll get it to you. And let him look at your policy. I mean, this is no guarantee that anything's going to happen, but who knows?
I just want to say, Art, we shared that tidbit with congressional staff, and they thought it was a really, really good point and a very interesting perspective. And we are also going to be publicly supporting a couple of business interruption bills that have been introduced.
Which is another reason to file your claims now while you're allowed to under the purview of your policy and before the government passes laws. Because the government generally will say, if you have filed a claim before such and such and such and such, before this law is passed, and again, I'm not an attorney, but it doesn't cost other than the time of an attorney to help you file the claim. Let's see. What site do we go to find out from our specific county about the reopening guidelines? I mean, I would think just like, I happen to know this particular doctor very well. He's a friend of mine. And I believe in his case, Orange County. So you just go to the probably Orange County Health Department or Los Angeles County Health Department, or, that's probably where they go, Ali, I would think.
Yeah, exactly. Yeah, every county has a COVID page these days, and they have their orders and things listed there. So I would just go there, or just Google it, and most of the times you can find it. So.
All right, your mechanics collect disposal fees. Hospitals and doctors have hazardous waste fees. We never question these, therefore we should charge a fee too. Am I right? It's a business, folks. I mean, I know it's the most horrible time in our history and in our lives, but we have a business to run. And when someone passes costs on to the automobile industry, to the grocery industry, they pass the costs on to their customers. That's what happens. I mean, that's how business works. So I don't have a problem with that. You have to do what you have to do. Would antibody screening kits in the office reduce any possible liability? I don't know.
I don't know either.
I think more is better than less, right, Ali? I mean, everything that you can do.
Yeah, I mean, I think it's good to know that. I think it's good to know that, but like all viruses do, this one is morphing as well. And so I think is one of the things that came out with the report of these tests, is that they may not necessarily indicate that you're somehow immune from COVID-19 if you test positive or if you have the antibodies, but it just means that for that virus that you got tested for, that you potentially could not get that one. But as we're seeing, there's some mutation already happening. So it's not a guarantee, but more information is better than that. And Art, I apologize, but I have to jump off.
Okay.
Yeah, you guys can stay, of course.
No.
But
Ali Ramshan, thank you so much for everything.
Thank you, everyone. Be safe.
For the dental profession. We'll take a couple more questions and we'll call it a day.
Bye.
Thanks, Ali.
Bye.
For the month of June, I will have my entire staff back. My PPP end date is June 15th. When I run June payroll on June 13th, can I pay my entire staff for the full month of June payroll? Okay. I'll have my staff back. My PPP end date is June 15th. So basically it's incurred and paid, as I understand it. So if you pay them for the month of June, you will have paid them in the covered period, again, unless they change the covered period. But if under the current rules, if you pay on June 15th and it's for after June 15th and your end date is June 15th, then it would not be forgivable. It has to be incurred and paid in the same period, in the covered period. I'm going to skip the labor ones because Ali is off here. Okay, let's keep going. Can't answer that. Vacation pay count for PPP forgiveness? Yes, I believe all compensation does. Then let's see what else. Take a couple more. Yep, I can't. That's a labor question. Let's go. Let me see if I go down here. Couple more. Let's see. I'm a single 1099 independent contractor with an S corp. I get $25,000 for the PPP loan. Should the max be $15,385? $15,385 is the maximum you can take if your compensation, Scott, correct me if I'm wrong, is over $100,000. If it's under $100,000, then it's whatever your comp was on your W-2 for 2019 divided by 52 times 8. I just had to do that yesterday. So that would be how that would work.
I think he's asking if he received too much money because
Oh.
his max salary is 15,385.
Yep. Yeah, he probably did. I mean, the only thing would be is he would not, I don't think under the guidance I saw, Megan, that he's going to get his pension or his health insurance. I don't think he's going to get it. We'll have to wait for the final guidance.
I think for the
It
S
may-
corporation, they typically.
Oh, he's
do.
I'm sorry. That's right. He's an S
Yeah,
corp.
the Schedule
So he
C,
would-
you're excluded.
Right.
And he
S
probably
corp
got.
would get- yeah, I'm still not convinced, Scott, that well, I guess because of the fact that his health insurance is going to be included in his wages if we do this right, then he might get it, but we got to wait to see what they say.
And he probably got the additional funds because they take the 2.5 months
Yeah.
times your 100K salary, whereas the 15,385 is just the 8 weeks. So that's probably why he got more money than the max allowable.
Also, the 25% for non-payroll costs is also something, you can utilize that money as well. You don't have to, that extra money can be used for that 25% that's not payroll.
Rent, utilities. Ali, so according to what we just said, LA County must, as far as whether you're required to be open or not, I would call HR for Health. I'm not qualified to answer that question. I got my PPP on 4/21. Can I pay rent for the month of April now using PPP? From 4/21 till 4/30? Yes, you can, because that's incurred. Let's see, business interruption, part of liability insurance or separate business policy. It really depends. I would call Randy on that. Let's just take one more. Sole proprietor can pay himself a wage out of PPP. Yes, you can if you had profits. If your profit's over 100,000, it's 15,385. If it's less, it's whatever your profit was. I think it's line 31 divided by 52 times 8. All right, I think we've covered most everything. I don't want to keep you guys here all day. Any final comments from anybody before we let the group go? I think we're good. Everybody, thank you so much for listening. I hope this has been really helpful for you. All of the folks are up there. Our numbers are up there. Megan has been so gracious in answering hundreds and hundreds of questions from dentists all over the country. If you're an HMWC client, again, a shout out to Pam Chamberlain, Don Watson, Sam Williams. They've just been fielding these questions unbelievably. I'm doing a lot of the consulting. Scott, for your clients, if they have questions, call their Eide Bailly partner or manager, whoever's handling their account. We're here to help you. If you have legal questions, there's Ali's number. Ali's group has been unbelievable. I mean, we've just sent tons of people over there. And for everyone, I'm going to say the same thing that I say every single week. The 5 words: failure is not an option. We're starting to open. Get your stuff together. Get your team together. Communicate with your team. Tell them you love them. Tell them that you're there to be there for them. Tell your patients that. You can be successful in opening up your dental offices. It's going to take work, but failure is not an option. And for Megan Mortimer, Dan Bywater, Art Wiederman, and Scott Haberman, and Ali Aramshian, thank you for attending our webinar today, and we'll see you next Tuesday. Bye-bye.